Hello, ma'am.
Hello, Pooja.
Hi. Good evening, everyone, and thank you for joining us today. This is the second part of our 8-part NEET PG prep series. The series aims to provide valuable insights on exam preparation by subject matter experts from Elsevier. Last week, we covered obstetrics and gynecology, and a recording of that is available on our Instagram channel. And today we will be diving into pediatrics as a subject, and let's welcome Dr. Anupama here. She is an esteemed pediatric consultant at the Chettinad Multi-Speciality Hospital in Karpakam, Tamil Nadu. She is also the author of this insightful book, which is called the Pediatrics Practical Essentials, published by Elsevier. This book helps build a strong foundation and mimics the examination framework, and it's structured to help medical students with a clear and systematic approach to clinical cases in pediatrics. Dr. Anupama has also published numerous research papers. She has contributed chapters also to the Indian Academy of Pediatrics. So let's dive into her insights and learn more about your NEET PG preparations for the subjects. Over to you, ma'am.
Thank you, Pooja. Hello, friends. Hope you all are preparing well for your upcoming NEET examination. First of all, I would like to thank Elsevier for organizing this platform, which helps the students to guide in the last-minute preparation. So in this talk, I will walk you through all the most important topics and the must-know topics before your exam. So after this session, you will be able to know most important topics in pediatrics in a simpler way that you will understand better. So before I go into the core topics, let me tell you, 5 to 8 questions will be asked out of your 200 questions. So though this number seem to be less, but all will be a direct question. Once you have read pediatrics and to general pediatrics, you will able to answer all the questions correctly. So I will divide this talk into two. One is I will deal about the general pediatrics, and the other one is your systemic pediatrics. But systemic pediatrics, most topics will be covered by your general medicine and pharmacology and pathology. So this general pediatrics, I will deal with 6 topics. So first and foremost is the important is your neonatology. So I will divide into 5 subtopics. One is I will start with antenatal period. So 3 important questions from this antenatal markers. One is your NIPT. What is this NIPT? Non-invasive prenatal testing. So what does it say? It is a marker for cell-free fetal DNA in maternal serum. You can do the test of gestational age. Why this is important is more than 99% you will have the negative predictive value correct. So this is an important MCQ for you. So the next one is your lung head ratio, LH ratio. So it identifies congenital diaphragmatic hernia and it's a prognosis. So if LH ratio is less than 1, it carries poor prognosis. How can you remember this? L for less. So lesser the score, the poorer the prognosis. The one recent advances in this is your LS ratio. What is this LS ratio? Lecithin sphingomyelin ratio. You will find after 34 weeks of gestational age in the amniotic fluid. If the LS ratio is more than 2:1, then the baby is having good lung maturity. It's a sign of lung maturity. So next we will move with the neonatal resuscitation program. So NRP is an important topic and there has been recent changes, and the recent one is your 8th edition. So 4 important points are there. One is your if there is nil heart rate at the end of 20 minutes, you are going to stop resuscitation. So this 20 minutes is an MCQ. The next one is your dose of adrenaline. This has been changed from 0.01 milligram per kg to 0.02 milligram per kg, 1 in 10,000 dilution for IV and IO access. If you are going to give it directly through ET, it's 0.1 milligram per kg, 1 in 1,000. So the next important point is your ET tube size. You can remember as 1, 2, 3. So 1 to 2 kg, 3 is the ET tube size. And the last one is your initial steps of resuscitation. So this you can remember with the mnemonic DSPS. So dry, stimulate, position and suction if necessary. So the next important in newborn is your scoring system. So you have four important scores. One is your Apgar score. So Apgar score does not indicate the child is asphyxiated. It tells you the neurodevelopment outcome later in life. So as the name suggests, APGAR, A for appearance, P for pulse rate, G for grimace, A for activity, and R for respiratory effort. It's not the respiratory rate, it's the respiratory effort. The next score is your Silverman-Anderson score. So what it indicates is your respiratory distress in a preterm baby. So the components, how can you remember, is NRG. So instead of NRP, remember as NRG. So NRG. So N for nasal flaring, R, there is three types of retraction, upper chest, lower chest and xiphoid retraction, and G for grunting. So the next score is your Downey score for term respiratory distress. So you can remember down a person will have gracious, so grace. So GRACE. So G for grunting, R for respiratory rate and retractions, A for air entry and C for cyanosis. So all the three scores, the highest one is the 10 and the more the severe the score, the severe the respiratory distress. So the most difficult one is your new Ballard score for preterm. So 3 points you can remember in a simple way. So one is the minimum and the maximum score in Ballard is -10 and 50. The minimum gestational age and the maximum gestational age which can be assessed is 20 to 44 weeks. And the signs which are included in Ballard score are neuromuscular maturity and physical maturity. So neuromuscular maturity I will divide into three. One is generalized, which consists of posture of the baby. Remember, as the gestational age advances, the tone increases, the joint laxity decreases. So one is generalized posture. The near the term, the baby will have a flexor toe. So the next one is your upper limb signs and lower limb signs. So in upper limb, you can remember as at each joint. So the shoulder joints with scarf sign, elbow with arm recoil, and the wrist is for square window. In lower limb, you can remember knee and ankle joint. So knee, you will have the popliteal angle, and the ankle, you have heel to ear. So this 6 components comes in neuromuscular scaling. So the next one is your physical maturity. You can remember as head to foot. So head, skin and lanuga, then ear and eyes, chest, breast bud, genitals, male and female, and the plantar surfaces. So totally it comes as 7 points. Why this is important is you may be asked in the exam as all the scores are included in the neuromuscular maturity except. So one or two may not be there and you have to choose that option. So the next one is your feeding assessment. So preterm feeding 28 to 32 weeks, you are going to start on NG tube. 32 weeks to 34 with Paladine, and more than 34 weeks, you are going to trial for breastfeeding. So another point important for in breastfeeding is your breast milk storage. So this is a very important MCQ. Often people get confused. So first, room temperature, you can store the breast milk up to 6 hours and 24 hours in refrigerator and 3 months in -20 or deep freezer. And the next important thing in breastfeeding is the alternate one is your cow milk feeding, and you have to know the side effects. So cow milk feeding, you can remember as 4C. So 1C is for constipation, colicky pain, CMPA, and increased casein level in breastfeeding. So another important one is your special situation in breastfeeding. So how can you remember this? One is your hepatitis B mother. Breast milk can be given. The next one is your HIV positive mother. In India, a developing nation, breast milk can be given. But in a developed nation, breast milk is not suggested instead of formula. So the third one is your active TB lesion with sputum positive TB. You should not give breast milk. And the last one is active varicella lesion in both the breasts. You should not give breast milk. So with this, we will complete the newborn topic. Next, I will move on to the one another most thing is developmental milestone. So you all know that there are 5 domains in developmental milestone: gross motor, fine motor, speech and language, social adaptive, and the recently added one is your cognition. So of all the 5, 3 is important. So gross motor, how can you remember this? The rule of law of development is It develops from cephalocaudal proximodistal. So when the child grows, so the initial stage is neck holding, which comes by 3 months. And 4 to 6 months, the child roll over, and 6 months, the child sit with support with a tripod position. 8 months, the child crawl. 9 months, 10 months, the child creep. Often there is a confusion between crawling and creeping. So crawling comes next to roll over, roll, crawl. You can remember at crawling at 8 months and creeping at 10 months. And 1 year, the child will stand without support and walk with support. So 15 months, the child should walk without support, and 18 months, the child should run. And 1 year, 2 foot up and down the stairs. And by 3 years, the child should keep 1 foot upstairs. How can you remember this? 1 foot, 3, we will climb up the tree. So 3 for climbing up the staircase. So by 4 years, the child will climb down the staircase. So this is for your gross motor development. Next one is your fine motor. So fine motor, how can you remember the components of 4? You can remember fine. So since we do fine things in our gadgets, so GADD. So G for your grasping, A for arranging the cubes, and D for your dressing skills, and another D for your drawing skills. So of the four, 3 is important. The first one is your grasping. So the child have bidextrous grasp by 4 months. This 4 is the initial age. So often we get confused. Remember, as FINE, it has 4 letters, so minimum age is 4 months. And by 6 months, it has unidextrous grasp. And by 9 months, it has immature pincer grasp, and by 1 year, it has mature pincer grasp. In the second year, the child is able to build a tower of 2 cubes. By 15 months, 3 by 18, and by 2 years, tower of 6. How can you remember this 6? 2 cross 2 is 4, add 2 plus 4 is 6. And by 3 years, the child will be able to build a tower of 9 cubes. How can you remember this? 3 cross 2 is 6, 3 plus 6 is 9. This is a simple way to remember and not to get confused. So the next one is your drawing skills. It goes by the mnemonic LOCX STD. LOCX So line, the child is able to draw a line by 18 months, or draw a circle by 3 years, and put a cross by 4, square by 4.5, triangle by 5, and diamond by 7. So don't get confused. Gross motor, the child is able to ride a tricycle by 3, but draw a triangle by 5 years. This we often will get confused. So next, another important topic is your growth and nutrition. So I will stick on with few important topics in this. One is your growth chart. The recently added topic in this topic is Intergrowth 21, which is used for pre-term assessment. So this assessment goes from first trimester till 2 years of age. So antenatally, we will assess the child physical growth with the crown rump length along with the postnatal growth up to 2 years of age. So the added advantages, in addition to physical growth, you will have neuromuscular or neurodevelopment assessment for the preterm postnatally also. This is used nowadays instead of your Fenton chart. So the next one is the growth chart for less than 5 years of age. It is WHO chart, and more than 5 years, it is IAP chart. So regarding the terminologies, so less than 5 years, we use SAM, MAM, and malnourished. More than 5 years, we use BMI, and the only indication or the marker is the underweight. So less than 5 years, how we can classify SAM. So 6 months to 5 years, you have 4 criteria to identify SAM. So 2 is your clinical, 2 is your objective. The 2 objective or your weight for height, which is less than -3 standard deviation, mid upper arm circumference less than 11.5, and 2 physical criteria is your visible clinical wasting and edema. So these all the same for less than 6 months or more than 49 centimeter, except for mid upper arm circumference. That is not included in less than 6 months. If at all the child is less than 49 centimeter, all the criteria are not included. The only criteria which is accepted is your visible clinical wasting. So I will deal with 3 scenarios in SAM, which are very important and often confusing. One is SAM with hypoglycemia. If the SAM child presents with hypoglycemia, that is less than 54 milligram per deciliter, what you will do? Assess the child is able to drink some fluids. If so, offer them 50 ml of 10% dextrose orally. Or else, if they cannot drink, give it as NG tube, 50 ml of 10% dextrose via NG. Or if the child is unconscious, seizing, you have to give 5 ml per kg of 10% dextrose via IV. So this is the guidelines for SAM with hypoglycemia. So next, the SAM child presenting with dehydration. For the first 2 hours, you have to give every 30 minutes 5 ml per kg of Resamol rehydration solution for malnourished. How will you prepare this? Take 1.7 liter of WHO ORS, mix with 4 grams of sugar and mix it with mineral mix solution. Then you will get the Resamol. So this solution should be exclusively given for SAM child to avoid fluid overload. So for the next 10 hours in dehydration, alternate every hour with 5 to 10 ml per kg of Resamol solution. So the third scenario is SAM child presenting with shock. So you have to identify shock. If you identify shock, treat them with small amount of bolus 10 ml per kg and the fluid of choice is half DNS and it should be given over 1 hour. So the add-on point in malnutrition is your NRC. What is this NRC? Nutrition Rehabilitation Center. This has been recently added. What does it signify? It is bridging the gap between the hospital stay and the home care. There, the child will get intensive feeding and emotional and psychological support for the child and to the family before they go reach their home. And most common and the most frequently asked MCQ is regarding the refeeding syndrome. Most common complication associated with refeeding syndrome is your hypophosphatemia. So the next topic is about vaccine. So vaccine, we follow national immunization schedule. So important one is IMI, Intensified Mission Indradhanush. We have read Mission Indradhanush, but now it has become Intensified Mission Indradhanush 5.0. So what does it indicate? You have to vaccinate all the unvaccinated or partially vaccinated children by 2023. So the Indradhanush indicates 7 rainbow colors. 7 vaccine preventable vaccines are included in this, except 2. Remember, JE and Haemophilus influenza B is not included in Mission Indradhanush. So the next one is your, how will you administer the vaccine? So any live or and inactivated vaccine can be given together, provided the gap between the 2 vaccine is 5 centimeter in the limb. So for any 2 live injectable vaccine to be given, that should be a minimum of 4 weeks gap. The last one is your how you administer vaccine. For intradermal, your bevel of the needle should be at 15 degree. For subcutaneous, it is 45. And for intramuscular, it is 90 degree. So the last topic in vaccine is your special situation. So if you get a child with bleeding diathesis or hemophilia child, which is the more common scenario, you have to give all the IM vaccine as subcutaneous. This is one. The next one is all the immunocompromised site should not receive live attenuated vaccine. And in HIV, you will divide it into 2. So one is asymptomatic HIV and symptomatic HIV. Asymptomatic HIV, all live vaccine can be given except BCG and OPV. So in symptomatic HIV, you should not give live attenuated vaccine except MMR and varicella until the CD4 count is more than 15%. If the count is more than 15%, you can give MMR and varicella. So, and the last one is your hepatitis B mother, positive mother. If the baby is born to her, you have to give vaccine as well as immunoglobulin within 12 hours of birth. So the next topic is infection. So when I say the name infection, we all will have to remember this fever with rash. So the day of onset of fever and the correlation with the disease. It will go by the mnemonic. Very sick person must take double tablet. So V for varicella, S for scarlet, P for pox, T for typhus, D for dengue, and another T for typhoid. So this relates with the onset of rash and the disease diagnosis. The next one is your 6th disease. What is the 6th disease? It is caused by HHV6. The other name for 6th disease is exanthem subtitum or roseola infantum. So how can you remember this? So in this 6th disease, there will be rose red like rash. So roseola infantum is most commonly it occurs less than 1 year of age. So roseola infantum. Another confusing one is your fifth disease. So, which is caused by parvovirus. The other name is slap cheek appearance. The other name for this slap cheek appearance or the disease per se is your erythema infectiosum. So erythema red and infectiosum, this parvovirus is very contagious. So this way you can remember this. The next one is the infection is your torch. So in torch only two is important, rubella and CMV. So rubella at birth, you will have the triad, sensory neural deafness, cataract and congenital heart disease. Most common congenital heart disease is your PDA. So it is the only torch infection which causes congenital heart disease in newborn. So the next one is your CMV. So in cytomegalovirus infection, the child will be sick. He will be, or he or she will be having hepatosplenomegaly, thrombocytopenia. And in ultrasound, you will find the periventricular calcification, V virus periventricular calcification. So the closest differential diagnosis for torch infection is your one metabolic disorder, which is galactosemia. In this, the baby will present at day 2 or 3 with huge hepatomegaly, hypoglycemia, and E. coli sepsis. So there you can find the investigations with galactose 1 UDP glucuronidase transferase deficiency. So this is an important DD for your torch infection. So the next, what you have to know in infection is your CME infection, which in later stage can produce conductive hearing loss also. This you have to remember, and you have to follow up the baby up to 18 months of age for conductive hearing loss. So the last part, what I am going to cover today is your genetics and chromosomal disorder. So whenever I say genetics, the first thing which will come to our mind is your pedigree chart. So I will give you a few steps so that you can you won't be confused and you can clear the diagnosis in a simple step. So step 1, whenever you have given a pedigree chart, see if all the offsprings are affected and the mother of the offspring are affected. In this case, the diagnosis will be your mitochondrial disorder. Step 2, see if the offspring in every generation is being affected. So this will give the diagnosis of autosomal dominant disorder. Step 3, see there is skip in disease in the generation. So this will give the answer for your autosomal recessive. Last one, see if all the male offsprings are affected. This will give the direct diagnosis of X-linked recessive disorder. So when we say chromosomal disorders, the most common is your trisomies. So how can you remember this trisomies? There are 3 which is more important: trisomy 13, 18 and 21. Trisomy 13 is Patau syndrome. How can you remember this? Pubertal age is at 13, so P for P, Patau syndrome. And the findings in Patau syndrome is all remember as P: frozen cephaly, cyclopia, plasia cutis, and thus cleft palate. So the next syndrome is your Edwards syndrome, trisomy 18. So how can you remember this? The right for voting age is 18, so 8 Edwards syndrome. So we will vote with our fingers, so you can remember as overlapping of fingers and rocker bottom feet is the pathognomic of Edwards syndrome. The next most common is your 21, trisomy 21 and Down syndrome. You can remember as drinking age allowed is 21, so Down syndrome drinking and trisomy 21. So 3 important points in Down syndrome is most common mutation is meiotic non-disjunction, and there is 100% transmission in the next generation in translocation 2121, and the most common congenital heart disease which is associated with Down syndrome is AV cushion defect, atrioventricular cushion defect. So other chromosomal disorder, what you can remember is your Dijot syndrome, which goes by Catch22, your cardiac defect, A for cleft palate, and T for thymic hypoplasia, abnormal facies, hypocalcemia, and H for hypocalcemia. So, and the chromosome 22 is being affected. The next one is your Williams syndrome. So, expand William, low birth weight, increased calcium, high risk stellate, and long philtrum, and abnormal facies, and swelling around the eye, and mental retardation. So the next one is your Prader-Willi, which you can remember as almond-shaped eyes, hyperphagia, and obesity. So with this, it will give you overall details about general pediatrics. So with the examination is coming up, please read wisely. And this pediatrics, don't omit if you haven't touched pediatrics, please spend 2 days to cover all the topics. If you have completed, revise it within 1 day, and you have finished the first revision, please revise it within half a day. So 2 months your exam is coming. So divide this 2 months as first 45 days, you can do your first revision, and the last 2 weeks exclusively for your first and second year basic subjects. So with this, you can prepare a schedule and stick up all the important notes wherever you frequently visit in your home or at places where you visit. And last, remember there is no shortcut to hard work. So strive or read, don't expect results. Instead, work towards them. I always remember what my professor used to say is it's better to bleed for success rather than to cry of failure. So the next year the topics will be different and your next is coming around. There will be more people appearing for the NEET examination. So give your best as the first shot. So thank you, and we will answer the questions now.
Thank you so much, ma'am. Ma'am, we have a couple of questions from the form we circulated earlier. Now, one of the questions that students have asked is around the common areas where student frequently mistakes, like, common pitfalls in an exam, and how student can avoid these pitfalls in an examination.
Okay, so one thing is, since NEET is an MCQ based question, the way you read is very important. So if you have four options, often I used to ask the juniors, what is your problem in answering those questions? What they will tell me is, the last two options we are getting confused, but it is not the way to answer NEET. So NEET is the, what you memorize, you will have to answer the question in that way. So before you see the options, you have to be thorough enough to answer the question. So that way you can avoid so many confusions. So for this, you have to read it thoroughly. So I will suggest, when you read a topic, try to remember as much as you can by keeping mnemonics or correlating with any favorite topic you like, whether it's movie, whether it's food, try to remember it. And don't even think like I will get a later date to revise this. So whenever you read, you just think that next day I'm going to appear for my exam and I should not forget until my exam. So this is how you read for NEET. So, and nowadays the pattern has been changed with one or two additional clinical scenarios, but the core topics remain the same from the past. So this way you can answer, or you cannot, you won't get confused in answering the questions.
Thank you, ma'am. So on the point of mnemonics and other techniques, we will also be circulating a PDF document later today and tomorrow. So that document will have all the mnemonics that ma'am, or the shortcuts that ma'am has covered in the session today. Ma'am, also there was another question that, if let's say if you're short on time, what are the must cover topics? Let's say someone has not been able to cover thoroughly all the topics. What are the essential 2 or 3 topics that they should definitely look for in an exam?
Yeah, so generally I will say the first and second year subjects are most important. So in a competitive exam, if you want to top the other candidates, the must know subject is your first and second year. Often many people will neglect that one because it's long way back we have read that subject and it is very difficult to remember. So if you got only short time, please focus on your first and second year subjects. See, in general medicine, surgery and OBGYN, you will surely get 30 to 40 questions. But of this 30 to 40 questions, even if you don't read, you will be able to answer 20. But the 20 questions, out of the 20, 10 will be very tough that we cannot answer at all. So but in basic subjects, 8 to 10 questions from each subject, for example, anatomy, physio and biochem, all these 10 questions you will be able to answer once you have read the subject thoroughly. So in this, you will score more than the other candidate. So at that time, your rank will come up. So if you have shortened time, please read your first and second year subjects and revise once before your exam. Give time more to concentrate on your first and second year. As far as pediatrics is concerned, concentrate on the general pediatrics. So you don't have to go on to respiratory, cardiovascular, hematology and all. All these will be dealt with general medicine and pharmacology if you have read that one. So general pediatrics, you can just quickly revise within a day. So you can spend a day to complete pediatrics.
Right. Ma'am, on that note, they've asked if there are any approach to tackling difficult or complex cases during the exam, and especially when, during the exam when a student is short on time, how should they quickly break down a question if there is a pediatric case, clinical case that they see in an
Yeah.
examination?
I will just tell you an example. So, if a newborn patient is coming to you, so for example, if it is from a torch infection, so the answer is rubella. So, they are given a 34-week preemie as delivered a preterm baby which did not cry, and it has been admitted in NICU. It has been connected to ventilator with these kind of settings. And on examination, you will see abnormal facies, cataract, and there is hepatosplenomegaly, and one another finding you heard a murmur when you examine your cardiovascular system. So ignore the first few lines where they have given the background. Just concentrate on the key points. So one is your murmur, cardiovascular system which is being involved, hepatosplenomegaly, and the cataract. So this will cleanse the diagnosis. And another way is all or except question comes. Please just go through the answers. Whichever strikes worst or this possibility cannot come to this question, that will be your except answer. So in that way, you can avoid so other confusions with that. So you can do that.
Yeah. Ma'am, the last question for today was around managing stress during the exam time. If you have any tips on that.
Yeah, the thing is, it's very difficult. So even everybody will feel nervous as the exam date is coming. So you take adequate rest. So 24 hours, we can divide it as 8 hours for sleep, including your afternoon nap, and 2 hours is for all the routine chores, taking bath, feeding, taking foods, and all. The remaining 14 hours, you have to prepare for your examination. So you don't have options because it's a competitive exam. So until you score higher rank, you will get the subject of your choice because this is going to decide your life, who you're going to be, a dermatologist, a physician, or a pediatrician. This is very crucial for anybody's life, and the future rests on this. So whatever important work you have, please postpone after June 23rd. Just concentrate on your studies. Tell your family members this is more important to me in my life. So please, I will come to you or we will talk about anything later after June 23rd. And the 2 months you have to read only for your need. So this is very important.
All right, ma'am. So there you have it, everybody. Study hard and rest well, and cover all your points from here on, ma'am. Those were all the questions that we have today. So just for a little information for everybody, like we said, we will be circulating, we will be sharing a PDF document with all the information that was shared today from the exam perspective. So you can download that from our Instagram channel and you can see all of those points. We are also circulating a code for buying Elsevier books from AIBH, so you can also use that code and avail that coupon. And that's all for today. I hope you all enjoyed this session. We have our next session planned on orthopedics, which is on 1st of May. So we will let you know more about that soon in our, again, on our Instagram channel. So please stay connected. And thank you so much for joining today. Thank you so much, ma'am, for
Yeah,
your time,
yeah.
and I hope to connect with you again. Thank you.
All the best. Yeah, sure.
Thank you, everybody.